Hello, and thank you everyone for joining us on our webinar tonight, Constitution Medicine Part 2, with a focus on the lymphatic constitution, lymphatics, and immune health. Today with me is Henrietta De Jong, and my name is Heather Schofield. We are both super excited to be able to present this webinar with Henrietta taking the lead as the expert in constitutional medicine. Just before we get started, I'd invite everybody to ask your questions through the Q&A section or in the chat room. We'll save the questions to the end, and then we will go through them one by one at that time after the presentation is finished tonight. Okay, so with all that said, I'm so excited to have Henrietta with us to present on constitutional medicine and the focus on the lymphatic constitution. She's got over 25 years of experience and is really focused in to practice on European biological medicine. As an expert within that field, she also has extensive experience with homotoxicology, drainage and detoxification, iridology, constitutional medicine, and then also modalities like sanomyopathics and psychosomatic energetics. Henrietta has this amazing ability to weave all these different modalities together under that European biological medicine umbrella and make very straightforward protocols that help her patients not only get to the root cause, but to get them feeling better in a very deep and profound way. So with that said, I'd like to pass things over to Henrietta, and we'll get started with the webinar tonight.
Well, thank you, Heather, and welcome everybody. Heather, again, it's such a wonderful opportunity to work with you. As you all know, Heather is the medical education director of Biomed, and she has done this for a very long time. She has a lot of knowledge and a lot of experience. Most of the questions she knows all the answers to. It is a pleasure to work with all the Biomed staff. I find they're all very well educated. They provide very good service in all the departments. The director, Gavin Ma, is a very honest man. He's trustworthy. Above all, I find he's an ethical businessman, and this shows throughout the entire company. I would say, yay, Biomed.
Thanks, Henrietta. So to get started, Henrietta, can you talk a little bit about what constitutional medicine is?
I absolutely will, with pleasure. If we think about the Constitution, so what is a Constitution? It basically is the state of the body and the sum of all the inborn characteristics. So it is the DNA basically passed forward through the generations. And when we look at our parents, our grandparents, even our great-grandparents, and this all comes to be in the first 7 years of our existence. And how this works, the DNA is there, but then the environment plays a big role. As we talk about nature and nurture, the environment that the child grows up in the first 7 years is of extreme importance because it highly influences how that DNA pattern is going to be set. So the individual person, the totality of that person is determined by these predispositions, but is the capability also to react to the environmental influences. And we have many influences. Number one is the psychological stress, then physical activity, rest and relaxation, medical interventions, of course, diet, nutrition, our water drinking, our miasms, it's sort of basically the inborn genetic problems. Okay? You are born with a disease as such. And weather and climate play a huge role. And, you know, it is so important that we realize all the things that can influence us. And we teach this from a European model of the iris diagnosis, and it's founded on that principle that we are born with that set constitution, basically the stuff from what we're made, and the combination of our strengths and weaknesses. Now, you know, when we talk about stress, psychological stress especially, I would like to mention as well the dysfunctional relationships. I see it very often in my office. It has a huge influence And of course, the nutrition, think about your refined sugars, your genetically modified foods, your unhealthy fat intake, poor sleep patterns, as I said, chemical exposures as well as radiation and pollutions, of course, taking drugs and alcohol, any abuse of any kind of medical prescriptions. This all has a high influence on how we become to be and who we are.
Henrietta, can you talk about the importance of constitutional medicine?
Absolutely. So we talked about that an individual constitution determines the typical disease patterns and expressions of disease and how that disease develops in the body. Okay, so learning how to identify each weak spots, the individual's weak spots, and the patterns that can develop is so important, because then preventing of these disease patterns from setting into early plays a big role. And of course, supporting the weak underlying areas, they strengthen the totality of our homeostasis, basically the balance that is within each of us.
And so with that said, why do we need to use constitutional medicine in our practices?
Well, all the constitutional remedies are the foundations for all the protocols. And so it is not that hard, because it's easy to determine if one has blue, brown, or mixed eye. We can do that with the naked eye. We can do it with a pen light. And in general, the patients immediately start to feel better when they're on the drop, and their health starts to be on track. And so we break the patterns of the disease according to the weaknesses they have. We strengthen those weak parts. We then predict the patterns of the weakness and disease. Okay, when are they going to set in? Okay, so then we prevent the weakness from basically developing into that disease. And so we resolve symptoms according to who they are. And then very important is, which we're going to talk about next, is homotoxicology. And that is, I use this all the time because it really is a great indicator on how we are walking the path of our genetics. Now, basically, this sums up what we learn about constitutional medicine. I also know that these webinars can give us a lot of information, and we sometimes get into information overload. So by learning a simple tool of just looking in the eyes of your patient and then applying the remedy that you know belongs with that color eye, it is not only fun, but it works. And, you know, you will start this by using that simple constitutional remedy. Of course, in our lymphatic constitution that we're discussing today, is always your lymphodrop, and you can't go wrong with that. That lymphodrop is an absolute phenomenal remedy, and it always works. I haven't seen it not work. And then, of course, according to the problems that we're finding, and we're going to talk about that in this webinar, we add the remedies that we need. And, you know, the beauty is that Biomed carries a little bit for everything. They have a tool for every problem that we encounter. And the company is very well versed that way in the fact that they have remedies for each case that we deal with, and whether we want to practice Phantom, we want to practice Rubimed, we want to do detox, there is something for everything.
That is true. Henrietta, Biomed is known as a one-stop shop.
Correct.
So talking about homotoxicology then, as it's part of constitutional medicine, can you do an overview of what homotoxicology is, just in the context of letting everyone just understand and have a glimpse into what this portion of the modality is about and the theory on how it works?
Well, we all know that disease is a result of the body trying to heal itself. And most of the symptoms of illness are a result of trying to get rid of toxins, and they should not be suppressed. Okay? So if we have somebody that has a common cold or a flu and they run a fever, what do we want to do? We want to get the fever down. And that is not the right answer. Now, it also depends on the level of the illness. If the illness gets more severe, we are going to have a hard time eliminating these toxins, and we start to show different symptoms. So if we can't excrete all these toxins, then we will see this in the urine, we see it in the bile, in the feces, and of course the toxins often get expelled through mucus. We can see that. Urine or feces can have mucus, diarrhea, fever. We start to vomit, and the stored toxins can then lead to chronic conditions and disease. Now, in minor conditions, the body will get rid of those toxins on its own. In the more serious conditions, we do need to look after that, and that's where we come into play with all the tools that we're going to teach you about. Now, if there is treatments that are suppressing those toxins, we think of antibiotics, we think of steroids, we think of drugs, we think of radiation, the toxins will only go deeper into the tissues, and that leads to very serious chronic degenerative diseases. And if treatment will eliminate those toxins, then the real healing will take place. And just a little reminder, as you see on this picture here, of course, the German physician Hans Reykjavik was the forerunner of this, and he taught us all of this, and it's extremely important, and we can see that in the next coming charts. So this chart we have, you read it by yourself and you have time to concentrate on it. It's very clear. It describes very well the 6 phases, and the table, it's the 6 phases basically of the disease progressions. And then Heather has another chart, I believe, here.
Yep. So with this chart, it goes into a little bit more detail. So the previous chart talks about what the 6 phases are for excretion, inflammation, deposition, impregnation, degeneration, and dedifferentiation. And this chart shows very specifically what types of symptoms or what types of conditions will show up in each one of those phases. Now, the idea is if you're in that excretion phase, you're in a very healthy, regulated body that's able to take care of toxins and to help clear them out and get the body back into rebalance. As the body holds on to more toxins and has less ability to let them go, then those toxins get interspersed into the tissues on deeper and deeper levels, and this is where you start to see symptoms showing up more severe as you go towards the right side of the chart. Once you get into that degenerative state or the dedifferentiation or neoplastic state, those are end stage in the different categories of the systems. The idea with homotoxicology, and this is also the idea with constitutional medicine and drainage and detox and understanding all of those concepts, is what we're trying to do with our patients is take them through the therapies and allow them to start moving back towards the left side of the chart, more towards that inflammatory and excretion stage, and getting the body back into re-regulation so that it can handle excreting the toxins on its own.
Very well said.
So, thank you. So then with that, and just the overview of homotoxicology, Henrietta, because we're talking about constitutional medicine and specifically the lymphatic constitution, can you describe in general why the lymphatic constitution is so important?
Well, it is extremely important. The lymph is the basic starting point in constitutional medicine. So in this case, always lymphodrop. And as you will see in the upcoming slides, we will talk about many treatment protocols and what can go wrong within the lymphatic system. But if we keep in mind that always lymphodrop and then all other remedies can be added to that base protocol of lymph, and depending on what symptoms are presenting.
Okay, so with that said, let's talk a little bit deeper about the lymphatic system. And so everybody can have a understanding of the anatomy and the physiology and how the lymphatic system works and how it's connected also in with the vascular and the immune system.
Absolutely. Now, the lymphatic function protects us, of course, against all infections, so all foreign invaders, as in bacteria and viruses. And the other importance is that it will maintain the body's fluid levels. It will also absorb the fats from the digestion. And, of course, very important, it will remove the cellular waste byproducts or toxins. It keeps the body's fluids in balance and therefore prevents the swelling and collects and carries the extra fluid from the body tissues, and it will return it to the blood circulation. Now, you know, just as a simple example, okay, think about your sinuses, which is lots of lymphoid tissue in the first place, or your tonsils, and then think about the gut connection. So if the exchange of nutrients and byproducts between the blood and the lymph vessels is in trouble, then think about your digestion, okay, the villi and your absorption surface in your small intestine, then we are in big trouble. Now, a beautiful remedy that biomed carrier called ribosan, and I will give you later on an example of that again, but this remedy is extremely important for restoring that absorption mechanism, and especially after people have had surgeries, long-term antibiotic use, long-term use of other medications, or radiation, and then, of course, we have to always follow that up with appropriate probiotics and enzymes.
And so we have here... Yeah, of course, which now brings us to the lymphatic organs and tissues.
Yeah. So, you know, think about your lymphatic system is basically your immune system because it's your defense. Now, so the lymphocytes are the white blood cells, and, of course, those cells include the natural killer cells, your T cells, your B cells, and we talk about those cells, we think about the natural killer cells, you think about your cancer patients, okay? We think about our allergy patients with the IgE and IgA. So those are extremely important, and they will be in your lymph nodes. And, of course, the bone marrow will produce those lymphocytes, and then the lymphoid tissue and the lymph fluid will contain them as well as we often see that is what the lymph tissue is for, is the waste products, the debris, the bacteria, and the proteins, and we have to appropriately get rid of them. So now the organs associated with that is the spleen, extremely important organ, the thymus, located in the chest area, of course, your tonsils, again, your adenoids, your appendix, bone marrow, of course, the stellate cells in your liver, and then not to forget, as we mentioned already, is those prior patches in the villi in your gut, the gut-associated lymphoid tissue.
And so that was a wonderful overview of the lymphatic system and then also the lymphatic organs and tissues. Before you dive deeper into the lymphatic constitution and constitutional medicine, can you talk as a brief overview about why lymphatic therapies are so important and the types of things that a lymphatic therapy will cover?
So what happens if we have a poor lymphatic flow? Well, we have a stagnant lymphatic system, and we get, of course, those toxins accumulate and the debris collects. Now, it is very important that we activate lymph movement. We need that. It is so important, that drainage, because we need to take care of inflammation and pain. We need to take care of those swollen glands that can follow, the congestion, the edema. So we need to stimulate the immune system. Think about what we just talked about, the sinuses, the ears, the throat infections, and that immune system needs to be repaired when it's weak. And think about all your patients that have multiple chemical sensitivities, your food allergies, your environmental issues. So we need to make sure we reduce that capillary permeability. So no edema, no fluid retention. Think about your cellulitis, which is quite common. And so we need to improve general circulation, eliminate the waste, the debris, and toxic loads. Now, think about your connective tissue, your interstitial, big word, fluid in between the cells. We also call that the mesenchyme. And as we know, a lot of the exchange of the nutrients and the byproducts take place in between that. Now, the importance is the electrolyte stability. Think about your sodium-potassium pump, which regulates numerous processes in the body, as in your heart rate, your muscle contraction. Think about your acid-base balance. And when we use Orphanum therapy, we talk about that as our milieu. Everything starts in our milieu. We need to keep that stable, and we need to keep it healthy at all times.
And so now I know you're going to talk about how to actually do that. Before you dive into the lymphatic constitution specifically, for those who haven't listened to the constitutional medicine introductory webinar, can you give an overview of the 3 constitutional types, and then we'll move into the specifics on the lymphatic constitution?
Absolutely. It is very simple. We have people with blue eyes. We call them the lymphatic type. We have people with brown eyes. We call them the hematogenic type. And we have people with mixed colored eyes. We call them the dyscratic type. Now, the blue eyes, of course, as we have been talking about, there is a lymphatic weakness. The prime remedy there is, the main is the lymph drop. The brown eyes, the hematogenic, they have weaknesses in the liver and the digestion, circulation as well. And the remedy we use there is called taraxacum. And then the dyscratic mixed colored eyes, they have weaknesses in their immune system. It's basically a combination of the blue and the brown. And for that, we use the Suya remedy. Now, this presentation is all about the lymph constitution in detail. But the next 2 webinars, we hope to be talking, Heather and I, about the brown and the mixed colored eyes in detail, as we do today about the lymph. Now, I would like to address very briefly, there was one question on the last webinar. Why do some people have one brown eye and some people have one blue eye? So that is simple. The question of pigmentation, and the pigment is called melanin, and it just depends on how that is distributed. It usually is a genetic factor, but sometimes it also comes into play when there's been an injury. So I hope that answers that question.
Yes, that's a great answer. And so because it is not very common, it probably also means we're not going to see it very often in practice.
No, as a matter of fact, it only occurs in less than 1% of the population.
And it's so fascinating when you do come across somebody with 2 different colored eyes. It's hard not to kind of look to try to see, and understand what's happening with their eyes. So that's a nice explanation for that.
Yeah, and
so
also
with that
to
overview,
remember, and we need to remember then we need to use both the lymph drop and the taraxacum because they have weaknesses in both those areas, correct? So we should always use both remedies.
That makes sense. So now with that overview of constitutional types, let's start to do that deep dive into the lymphatic constitution. And so our next set of slides are talking about the lymphatic constitution and then starting to go into the subtypes.
Okay, now as a review here, the lymphatic constitution, of course the eye color is blue, but it can also be pale green or gray. Your patient's complexion often is fair, and you will see some slight pigmentation on the skin. Interesting is to observe their physical structure. They have a large bone structure, often large muscles and very broad shoulders and a very muscular chest. Now, as we said before, the possible diseases that can occur is your otitis media, your chronic ear infections, chronic nose and throat infections, so basically your ENT, your sinusitis, then you drain it down to the bronchioles, so you have bronchitis, and very serious GI infections. You can have duodenitis, gastritis, pancreatitis, and all of these things will cause chronic inflammation in the body, which then will lead the patients to feel like they have rheumatism. And as the lymph drains down from the gut to the bladder and the kidneys, we will see the chronic bladder and kidneys infections. We will also note that a lot of these blue-eyed people, you'll find them, they have a nervous constitution. And often they have early calcifications of the tissues. They have environmental or food allergies or chemical sensitivities. And of course, the weakness is the lymphatic system, the skin, because if the lymph doesn't flow well and congests, the toxins get dumped into the skin. Think about all your rashes, of course, all the mucous membranes, and the nervous system. Now, while all of these apply, there can be many different variations. And it's also important to know that the lymphatic constitution is also known as the penicillium type in pleomorphism or in the sanum for the sanum users. Now, when it comes to the bone structure, we can identify them as the mesomorph, as muscular, and they tend to develop muscles very easy, and they are very strong. They're naturally strong people. And their weight distribution, we can use that to call them the ovarian or the thyroid pituitary type, as in the endocrine system. And they gain the weight very easy, especially when they eat too much carbs and they have no exercise. That nice roll of fat, you will see that occurring around the belly.
Great. And so within the lymphatic constitution, I understand then we've got the 3 subtypes, the liver, the spleen, and the kidney subtype. So can you do a quick overview of those, and then we'll go and talk about each one individually?
Absolutely. So the key issue with the subtype is that you have to observe the color around the iris. Yeah, so in the liver type, which we call the hepatopathological constitution, you'll see a darker ring around that pupil. And with the spleen subtype, which is called the splenopathological constitution, it is a little bit of an opaque ring. You can't see through it. And then with the kidney subtype, which we call the nephropathological constitution, it is more of a see-through, more of a whitish ring around that pupil. And then I'd love to go right into that, into the next slide, and talk about that liver subtype. Again, so it's a blue iris with yellow, golden brown ring around the pupil, and this eye is a very clear example of that. Now, the liver disorder symptoms, the diseases that you can see, or the symptoms, first of all, there is portal vein congestion, the backup of fluid. We can have gallstones, or we can have sludge in the gallbladder, which often leads then to constipation. You can have the yellow tint, the jaundice on the skin. You can observe dark urine with often foamy, kind of slimy things on top of it. Often these people develop varicose veins because of the fluid backup in their system, and of course the constipation leads then to hemorrhoids. The remedies that I like using for this is the Cardis and the Taraxacum. And so in your office, then you can see a typical patient coming in, and they will complain to you about dull or sharp pain in the right side. They will tell you, oh, I'm so gassy, I'm so bloated, and I can't poop. So they cannot tolerate fat in general. Okay, so that always leads me to think, okay, here we have the sludge or the stones in the gallbladder or the bile ducts. So we definitely have to teach them to eat proper fats. Think about your coconut, your avocado, or your olive oils, and avoid the deep frying and you know, the junky oils like the ones that are out on the market there, your canola. Also, one thing that I always teach my patients is to avoid eating nuts because they cannot digest them when they have gallbladder issues. And so the bile is not released into the small intestine appropriately when they have the sludge and the stones sitting in there. And, you know, we develop most often all these above symptoms that we just talked about. So what do we start with? Of course, first our constitutional remedy, which is the lymphodrop, and then you build upon that protocol using your Cardis or your Taraxacum. I often use Cardis with portal vein congestion, with constipation. You know, when you see how toxic patients are, you definitely need to add your Taraxacum because it's a great detoxifier. It will also look after the circulation part, as in the varicose veins, and of course, a hemorrhoid is a varicose vein. So in that case, if they have most of the symptoms, you need to add both of these products to the lymphodrop. Now we'll dive right into the next slide here, which is the spleen. Again, when you look at this, you see that opaque. It's like you cannot see through this ring. Sometimes you find it's a clay colored, and it will be around the pupil, of course. And then your spleen symptoms. The spleen is an extremely important organ, and often it's overseen. When you think of a patient that comes in with just diarrhea and there's an unknown cause, start thinking about your spleen. When people have spleen enlargement, they will have that stabbing pain in their sides, and you'll find these people feel horrible just after eating because it aggravates their symptoms. And they feel better on an empty stomach. These people can develop serious viral infections, especially in adults. And of course, they have, again, the congestion in the circulation, in venous circulation, with that sludge starting to occur. And that will then lead to this thrombus formation, the blood clots. Now, the remedies we can use in this case is Cleo-Acu to stop the diarrhea, Cleopin, Lapa, a blood cleanser, and Suya always to build that immunity. So, you know, these patients, the typical patient with spleen symptoms, and in this area, in this category here, you'll find that these patients are always eating in a hurry. They're not chewing properly, and they tend to be overthinkers. So think about the liver-spleen connection in traditional Chinese medicine. It is very interesting because these patients, they feel much better if they don't eat. And again, I would start with that lymphodrop. I always add Cleopin, always, wonderful remedy, works beautifully. And then depending on the symptoms, again, if they have the diarrhea, you know, use that Cleo-Acu to stop that. And then I loved that Lapa remedy. I love to add that because it cleans everything up, including your blood. Now, the last one here, we go into the kidney subtype. And again, that iris, this is a beautiful picture. You'll see that transparent yellowish whitish around that pupil. And you know that those patients will often have kidney and bladder trouble. They will present with either acute or chronic infections in the kidney, in the bladder. They can collect kidney stones, or that gravel formation can start, or they can have uric acid, which can as we know, lead to gout, which is extremely painful. They will have burning pain. They will also have discharges. It can be just mucousy again, but yellowish, greenish can come from the urethra, and they have poor urine flow. Now, remedies to use here is Solidago or the Bucco, and in case of the uric acid formation, I love using cleoformazan. And then if you have a patient with gout, you can also add the polygonum in there. It works beautifully. Now, so as I said, we find patients in our office with lots of chronic bladder infections in this case. And just a reminder, when these infections are chronic, they need to be on these remedies for prolonged periods. Out of interest sake, for the people that practice RubyMed, you'll find people with those chronic bladder infections, they have large unresolved conflicts in chakra 1, and they need to be addressed. Also come across the more serious kidney infections, pyelonephritis, which can be acute or it can be chronic. So again, we start with lymphodrops, then we add the Solidago or Bucco, or in some serious cases, I like to add them both because they both work a little differently. And again, for the people that have the kidney stones and the gravel formation there, cleoform, very important. If they do experience gout symptoms, then polygonum. That sums that up.
That was a great summary of the 3 different subtypes. And so now we're going to start talking about solutions for the lymphatic constitution and some types of protocols that can be helpful in how to practically incorporate this. With lymphodrop being your key foundational remedy for the lymphatic constitution, can you talk about this specific remedy a little bit more?
Absolutely, Heather. I think lymphodrop is my most favorite remedy of everything because it works in so many situations and it works so well. So it works on the body's elimination organs. It has remedies in there for the liver as well. So you start draining the lymph system as well as the biliary tract, the digestive tract. It helps, of course, to improve the skin. It will help improve lungs. It is extremely good for immune support and not to forget the reduction in all these allergy responses that can take place. Now, specific conditions that we come across, of course, again, in the lymphatic congestion is lymphadenitis, lymphangitis, lymphedema, lymphadenopathy, edema. We can see this, of course, especially lymphedema in our cancer patients. We can see it after surgeries. It can be extremely acute. It can be secondary to other conditions. Sports injuries. Now, this is one remedy to use for sports injuries. Pain, strains, any injuries, swelling, contusions, hematomas, it works wonderfully. And in the systemic diseases, as we discussed, the allergies, it also helps in scarring, post-surgical. Any scars, burns also is very important. Eczemas, in case of allergies, rashes. And in our little guys, the pediatrics, their swollen glands and the recurrent chronic infections, especially the ear infections, is very common. And of course, in all our detoxification programs, it's very important for detox, general health maintenance, and disease prevention. And we've learned that the lymph system is now our biggest detox pathway. It's part of our immune system. It's part of our defense mechanism against all diseases. It's part of our circulatory system. It transports nutrients and waste, also transports hormones and their byproducts. Think about people with problems in the breast often can't get rid of their byproducts of the hormones that the body has used. Just think about your lymph system. As I said, it drains from head to toe, so it is very involved. And then the next slide brings us to all the ingredients. And you can read that for yourself. You see there's cardas in there as well. There is stuff like a podium for the gallbladder. There's stuff for the circulation. And there is stuff for the skin. There's some taraxacum in there. It basically has everything. That's why it's such a wonderful remedy. So the recommended dosages are here for the adults and the children over 10 years. Take 10 drops twice a day or 3 times a day. Children from 4 to 10, 4 to 6 drops, 2 to 3 times daily. And then the children 1 to 3, 4 to 5 drops, 2 to 3 times daily. I always like to dose my patients twice a day because it's better for compliance. Otherwise, you hear the complaints, well, do I have to take it in my lunch kit, or I don't want to take it 3 times a day. So I find in general the compliance is a bit better when you do it twice a day.
Now, thank you for talking about Lympha-Drop since it's the key foundational remedy for the lymphatic constitution. And I believe that this is a summary of what you've already talked about as far as the lymphatic constitution with Lympha-Drop, 10 drops twice a day. You talked about the immune system, including the spleen, the lymph, the thymus, skin, the mucous membranes, the nervous system, and the autonomic nervous system, and then the type of constitutional symptoms in that summary slide that you had that talked about frequent or reoccurring infections, anything ending in itis or itis, like sinusitis, bronchitis, cystitis, otitis, gastritis, of course, lymphatic congestion and edema that may go with that, types of allergic reactions that are connected with edema and lymphatic type reactions, and then, of course, the nervous system. And so taking all of that information then, let's move into some protocols that are very common types of things as far as conditions and symptoms that are seen underneath the lymphatic constitution, and that will be very relevant for those patients that have the blue eyes, including all the different versions and the subtypes of the blue eyes. So the types of protocols, and when we're bringing it all together, we're going to cover off some lymphatic protocols, including allergies and skin rashes, immune building and immune strengthening protocols, and looking at sinusitis and bronchitis, a nervous system building stress resilience protocol, a kidney protocol, which also covers off bladder support and cystitis and urinary tract infections, and finally some liver protocols that also cover off with the gallbladder and digestion as a whole. And so since we're talking about the lymphatic constitution, the first protocol to talk about is the lymphatic congestion protocol.
This is one of our key protocols, and it's very simple. We need Lympha-Drops. When we're congested, the fluid backs up. So we need Lympha-Drops, 10 drops in water twice a day. Like I said, I love to add LAPA because it will clean the lymph as well as a blood cleanser. So we can put a teaspoon in water twice a day. And both of these drops can simply go into the same water and be taken before breakfast and supper. And then they don't have to wait forever to eat as long as it can hit the empty stomach. And then other things that are very important, I love sending my people for lymphatic massages. They can do some dry brushing. They can do some rebounding on the trampoline. Of course, simple walking and just moving, very important for the lymph system. Keep it going, keep it flowing. And the sauna also works very well.
And these are all things that can be done on your own time, and they don't necessarily cost any money aside from the massage to be able to do these types of things. So there's lots of ways to promote lymphatic drainage and lymphatic health that can be incorporated into daily routine. Up next is allergy protocol in context with the lymphatic constitution.
I just have to say, I love that picture from that kitty there. anyways, talk about allergies. They can cause great allergies. Now, again, we go to lymphodrop first, 10 drops twice a day in general. Also, just a keynote here to think about your sensitive patients because they cannot tolerate as much as your other patients. You always, start with a lower dosage, so 5 drops twice a day, and then increase it slowly if they can handle it. Now, for the symptom relief of allergies, Biomed has some beautiful products. They reduce your inflammation and the histamine production, so we use Allernet. 10 to 15 drops twice a day or 3 times a day, whatever works for your patients. Allergies, I love that product. It's very good for allergies. Easy 2 capsules a day with food. Twice a day is even better. Again, sensitive people, I usually do just 2 capsules daily. And then incorporate vitamin C. Always, always vitamin C for your allergy patients. Never forget your vitamin C. And don't hesitate to use 4 grams a day for the C boost. It's 2 scoops, and you mix it in water. I like to mix it in lukewarm water, and it's a very soothing drink, and it really helps a lot. Now, you have a beautiful piece here underneath about the intestinal support. Heather, that's very important that you put that in because all the mucous membranes are very connected to the gut. And I will give you an example here. I remember a patient that had colon cancer, and this patient had undergone several surgeries, multiple antibiotics, radiation, and this patient ended up with very severe diarrhea and then was given Imodium to stop this diarrhea. So after all of this was said, we can, of course, understand that the gut flora was totally destroyed. So this poor guy did not eat, and he could not eat. So I started him just on a couple things. And first of all, here is the Ribosan again. We use that to improve those Peyer's patches and the absorption service. Then I added in basic caps. Of course, we need to restore the pH balance. And then I get pretty strict because I have this patient measure his urine every day, each time they go to the bathroom, because we want to see where they're at, because we want them in the proper area for their acid base. And then not to forget, when your patient is very acidic, the kidneys have a very hard time eliminating these acids, so we need to support those kidneys. So I added the Solidago, and then within a week of just doing the Ribosan, the basic tabs, and the Solidago, this patient was back eating and feeling much better. And of course, we pay attention to diet as well. That's very important. Then after that, I started this patient on some Sanum remedies. I included Sanuvis and Pleocitro to increase the vitality or the energy. And just remember, the Sanuvis is still a good deacidifier gut-wise, and the Pleocitro is very good to cope with allergies. It helps enormously. It restores that cellular respiration. Now, this patient also had yeast overgrowth, so we needed to address that, and we used Pleoelp or Pleopef for that. And, it didn't take us long. In a matter of a month to 6 weeks, this patient was feeling much, much better. And we, of course, also did appropriate enzymes and probiotics. Now, I still see this patient on a regular basis, and he has been cancer-free for 5 years and is doing extremely well.
That's such good news, Henrietta, that your patient is doing so well and not very complicated as far as protocols go.
No, and if you do the protocols in steps, they don't get so overwhelmed. But you have to make sure you address those Peyer's patches because we need to restore them. And you have beautiful products in that intestinal kit that you have, and basically all of the products are in there, I believe, that I just summed up there.
Yeah, absolutely. Yep, absolutely, yes. And we will definitely come back to considering intestinal support again throughout some of these other protocols. So we've got also talking about skin rashes in respect to allergic-like reactions, which is part of the lymphatic constitution. So hives and eczema and psoriasis can fall into this category as well. One of the products that you can use topically, both for symptomatic relief and then also as a detoxing strategy, is called Luvos powder. So you would want to make sure that you have your core lymphatic remedy as Lympha-Drop in the same type of dosing, that 10 drops twice a day. And then you're using the Luvos powder topically or symptomatically wherever the skin rash may be or where some of the hives breakout is happening. And so you take the powder and you mix it with water, and then as a paste you would apply it to the affected area. Luvos, it's a mineral earth that's mined from glacial deposits, and so it's got a very porous surface. And so one of the things that the Luvos powder does is it is able to soak up toxins. So it's able to soak up whatever is superficially on the skin as far as toxins go. And then in additionally, as the powder starts to dry, then it helps to increase the blood flow to the area and also oxygen to the area. So that's helping in that detoxification and healing process as well. And so you would make the powder up into a paste, and then you apply it to the affected area. You allow it to dry completely, and then you rinse it off with warm water. If in addition to skin rashes, there's also some fungal indications or fungal skin infections, you can also add in Pleoalb drops or ointment, Pleopef drops or ointment, which are the two of the Pleosanum candida fungal species. And as Henrietta shared yesterday with me, she likes to always put in the Pleosan staph drops. Staphylococcus is a species that, a bacterial species that lives on the skin. And whenever there's a break in the skin, staph is one of the main bacteria that can get in the skin and cause infections. And so when you have rashes, you can also have open wounds, and the staph can just be getting in there and creating more irritation. So choosing Pleoalb or Pleopef with Pleosan staph can really be a nice topical treatment while you're working on the deeper causes to help patients with their symptoms.
Yeah, often these patients, they are very itchy, and without realizing, even in their sleep, they scratch open these areas, and that's why the staph gets in there. And I find this protocol is extremely successful, and it relieves them quite quickly from, the itch especially.
Yes, absolutely. It really helps. Sometimes the itch, if you've got nothing else, some baking soda mixed with some water applied topically, because it's so alkaline, it can help with an emergency itch.
Yeah, put them in the bath water.
Yep, exactly. Moving on to the immune strengthening protocol.
Okay, so the core remedy again is the lymphatic, the Lympha-Drop, and other things that we can use is the organotherapy. A very, very successful one is Pleothyme. That is the thymus glandular, and one capsule once a day is perfect. And then we find also Immunoplex, which is wonderful, 2 capsules twice a day. Again, we're back to the Pleo skin for the spleen and the lymph, 10 drops once a day is good, or 5 twice a day, whatever works. There we back to the Pleo Ribosan for restoring the Peyer's patches, and 1 capsule once a day is plenty for that. And I just want to make a quick comment here. When we're practicing, again, when we're doing Rubamid, when a patient is in chakra 4, they need extra immune support, extremely important, because they are very vulnerable dealing with the severe, intense conflicts that can occur in chakra 4. So I then often add some suya or cleothyme or even mycoimmune is very, very useful.
Perfect. And one of the things I wanted to add, and Henrietta did mention this earlier within the presentation, that Biomed is a company that you're able to get a lot of very unique remedies from. Sanum isopathics and Sanum organotherapy happens to be one of those very unique opportunities for getting different types of medicine that are very, very effective. And so going after the very specific organotherapy component of the immune system can really provide some beautiful strengthening for your patients. So the thymus and the spleen and the lymph and the Peyer's patches, in addition to the gut-associated lymph tissue, and you put that all together and you've really got this powerhouse to not only help regenerate the major immune organs, but also stimulate them to get them working again without doing too much stimulation or throwing people into any sort of intense reactions.
That's correct. Absolutely.
So continuing on the immune thread, we next have a sinusitis and a rhinitis protocol recommendation.
Yeah, this is also a very simple protocol, but very, of course, very common to see the sinusitis and the runny nose. So again, we start with a core remedy, the lymph drop. 10 drops twice a day, and I often use for symptomatic relief and to reduce the inflammation, that hydrostasis nasal spray works very well. For the sensitive people, use only one spray because it can be a bit intense. For people that tolerate it, you can go up to 2 sprays in each nostril, up to 3 times a day. Again, we use the C-Boost, 1 to 2 scoops. And especially with allergies, again, when that causes issues here for sinusitis, I don't hesitate to go up to that 4 grams. We can add Immunoplex to calm things down, 1 to 2 capsules twice a day. Now, here comes a very important remedy called serrapeptase. If you'll find these people are very mucousy, you'll hear them clearing their throat continuously. When I hear in my bathing room, I hear a lot of clearing of the throat, I often know I have lymphatic people that have infections. So serrapeptase is a must. So 1 capsule once a day, basically on an empty stomach. And if they have very acute symptoms, we can also go to the Lufa tablets, and including the hydrostasis nasal spray separately or together. And, you know, again, thinking of tonsils and sinuses or teeth, they often carry all the bacteria, and often this is related to gut problems. So don't forget to restore your pH and proper diet.
All right. Henrietta, are you able to talk about bronchitis, the bronchitis protocol from the lymphatic constitution perspective?
Absolutely, Heather. Again, we look at our core constitutional remedy. It's lymph drop again, 10 drops twice a day in water. We can add bronca, which is a wonderful remedy. I use that so often in my patients. It really relieves the cough. It doesn't take long to take effect. We can use a large dosage, up to 40 drops in water, and we can use it up to 5-6 times a day. The C-Boost needs to be in there again. You know, we have to be a little bit careful because sometimes the bowel gets a little loose if we use too much from the sensitive patients. But again, with these itises, I like to use 4 grams if we can. If not, we can just do the 2 grams, which is very useful as well. Again, think about people coughing and hacking and having all this phlegm in their mucous membrane, this extra mucus that they can't get rid of. It congests them, so let's break it up with that serrapeptase. We do 1 capsule 1 to 2 times a day. Empty stomach is important. Now, for the acute symptoms, I love to add BioBoost in there, 20 drops, 30 drops twice a day. It works. Now, if that isn't enough, we have something for the Sanum user or for all of us called Pleosan Kleps. It is very effective for pneumonias, any bronchial symptoms, very, very helpful. And again, the mucous membranes are connected with the gut, because we have lots of mucous membranes in there, and they're all connected. We need to make sure that that gut is working. Another thing that I would like to add is that when we have flu or viral infections, I like to add the Fluence in there. Sometimes I do the combination of Fluence, BioBoost, and Pleosan Kleps, and it works wonders together. They're beautiful remedies.
Henrietta, when you're on the topic of talking about viral and flu, I know in the chat room there's been some questions about using bronca or using a lymphodrop for post-COVID symptoms to help with recovery. Do you have any comments around that?
Absolutely. I have treated some patients with COVID symptoms and COVID recovery, and a very powerful combination there was that BioBoost, Fluence, and Pleosan Kleps. Very, very powerful combination. And in high dosages, it works extremely well. And of course, when the lungs are involved, we must relieve that cough. And I put the bronca in there as well. And high doses of vitamin C. We can add some quercetin. All these are very important remedies, and they're very successful.
Perfect. Thank you for answering that question. I know it's on the front of many people's minds.
Of course it is.
Okay. So next we're going to talk about nervous system and building resilience within the lymphatic constitution. Now,
as we said, that those blue-eyed people have often weakened nervous systems. They're not as resilient in there as the other constitutions. So we really need to look after that. And I always feel very sorry for those people that are constantly anxious and need adrenal support and that are always fatigued and suffer from adrenal fatigue, very common in our patients, very common in our society, and it needs to be addressed. Avena sativa is a beautiful remedy. It's a calming remedy. I often use that in cases of people that sleepwalk, that have nightmares or horrible dreams. I start them off on a lower dose in the morning, and then at bedtime, specifically at bedtime, 20 minutes before bed, I give them up to 30 drops, even a bit more, in water, and they are much calmer. They have a better rest. They sleep better. They don't dream nearly as much, especially for the kids that have those night terrors. It calms them down. And then our adrenum is a must because it strengthens those adrenal glands that are often weak in the cases of the blue-eyed people, and we need to look after that. Now, at the bottom of the slide, three very important remedies. Paravita and its exhaustion, unable to recuperate, they're sluggish, so these patients just drag themselves through the day, and they cannot get any motivation, no energy, and they just cannot get going. Paravita, a wonderful remedy, 6 to 12 drops in water twice daily. Do not give this patient those drops after noon because they will be very activated at night, and they can't calm down before bed. So noon is the time, the cutoff time there. Sometimes I give them the 12 drops all at once in the morning, and that seems to work very well too, because they become, if we give them too late in the day, they become hyper. Now we have Stimvita. These are for the restless patients. They can't calm their brain down. They can't sleep. They can't relax. We'll have these patients when they sit in your office, they wiggle around in the chair. They're constantly looking here, there, and everywhere. The concentration is gone. Again, 6 to 12 drops in water twice a day, morning and evening. Then the last but not the least is the Neurovita. And these patients have pain everywhere. You'll see your fibromyalgia patients come in your office. They feel pain everywhere. And their adrenal system is basically, it's shot. So we need to give this Neurovita for the stress, for the tension, for the pain, 6 to 12 drops in water twice a day, morning and evening. I cannot emphasize enough to treat adrenal fatigue. Your patient is not well and can't get well without having their adrenal function restored.
Henrietta, just before we move on, for adrenum, can you dose that at any time during the day?
I do. You have the odd one that will tell you, I can't take this too late in the day, the same thing as kind of your part of Vita, but I have, in general, dosed them twice a day before breakfast and supper and have no issues with it.
Mm-hmm. I know one of the things, the way adrenum is made as far as the formula goes, it's more of a restorative and regenerative for the adrenal glands. Like it's a nutrition and nurturing remedy. It's not a stimulating remedy. So typically, also I understand it that most people can tolerate it at any time because it's working at nourishing the adrenal glands and helping move out of the adrenal fatigue and exhaustion.
Yeah, it works also quite quickly. Within 4 to 6 weeks, my patients always tell me I feel much stronger when they're on adrenum. So it's a very important remedy.
Mm-hmm. All right, 2 last protocols. So this is the one that's covering off on the kidney subtype for the lymphatic constitution, and so kidney, cystitis, and urinary tract infection protocol.
Again, we start with the core remedy, the lymphatic constitution, core remedy, lymphodrop. Again, 10 drops twice a day in water, and you add I like to add the Solidago often for the kidney drainage as well as kidney infections. It also does help for your bladder infections, but I like to also add bucco in there, a teaspoon in water, twice a day, 3 times a day, and together they make a very strong protocol for kidney and bladder infections. Sometimes the Solidago on its own is enough, especially in drainage situations when they just can't pee. They just retain their fluid, always Solidago. Now, again, for acute bladder, I use both of them, the cystitis, and they have pain upon urination. It burns when they pee. Solidago, definitely. Bucco included, definitely. We can go dose quite high for it, 40 drops, even up to 5 to 6 times daily, and it works wonders, works very well.
Perfect. And then our last protocol here, which is covering the liver subtype of the lymphatic constitution. So we've got some protocols here for support for the liver, the gallbladder, and digestion.
Yeah, there's a lot of beautiful remedies in this protocol. And when we have for liver support, we can use A. hepatica. It also works very well for duodenitis. It works for gastritis. I find it restores the bile flow. It helps people digest better. The Cardis is for portal vein congestion. Again, constipation. It restores that blood flow to that liver that is so important. People get constipated. There is definitely some ingredients in there that will help those bowels to move. Then we have the high cholesterol, and I use Cardinera for that all the time, 30 to 40 drops twice a day, and it brings it down beautifully. It works. Taraxacum is our liver detox, also the portal vein congestion, also the blood flow, very important in the circulatory problems, gallbladder support in case of that sludge again, and the stones. Cardis works very well, and we can use high dosages there, 35, 40 drops. Again, think about your sensitive people. They will not tolerate those high dosages, so start low. And then, of course, for the stomach acid, we have a product called Absinthium that really works well. I use that product a lot on those pediatrics, the little guys that don't want to eat anything, the picky eaters that refuse to eat the good stuff. It restores that appetite appropriately, and they will start eating better after you use Absinthium. 25 drops in water before meals, twice a day. It works wonders.
Great, and thank you for covering off on all of those protocols. So as far as the presentation goes, we have wrapped up what Henrietta is presenting tonight. So again, thank everybody. I thank all of you for attending and listening to constitutional medicine with the focus on the lymphatic system and the lymphatic constitution. I now invite you, if you've got any questions, please type them into the chat room or type them into the Q&A section, and we'll spend the next 10 minutes or so answering questions. So Kathy was asking about radiation treatment, if there's drainage remedies that can help for the after effects of radiation treatments.
Absolutely. There's your Lymphodrop. It works like a charm. And, also you can add Taraxacum to that and Solidago as a combo, which will work on the kidneys and the bladder and the liver as well. But Lymphodrop works, it's key. If your patient has undergone radiation, always Lymphodrop. Okay,
that's a great tip. I also know Kathy also asked about using Luvos topically around the eyes after radiation treatment of the eyes, and so I just had replied back through the chat room that it would be safe, of course, to do that, and that could help soak up any local toxins in addition to what might be occurring in that area. Okay, so next question. Dr. Eileen Eng asked, and this is something I've wondered myself, so I'm really glad she asked this question. Can you talk about Asian constitutions? Because of the color of so many people of Asian descent to their eyes, does that mean all Asians are liver constitutions?
Often, yes. They often have digestive issues. But you have to be very careful, because I also find with the Asian constitutions that they're not always the pure brown eye. You often see a mixture in there, and then you have to think of their immune systems. So, yeah, they have more problems with the liver than the lymphatic system. You see that quite commonly, and I always use the Taraxacum for them, and other digestive remedies is necessary, but they often have issues in their gut and very often in their circulation.
Okay, that's great to know. Thank you. So just scrolling through here. Oh, yes, costochondritis. Could Lymphodrop be helpful in cases of costochondritis where you've got that inflammation of the cartilage by the sternum and the ribs?
Yes, absolutely. You can combine that with polygonum as well, and we have some of the biomed supplements as well that can be used for that. Your curcumin is there, curcumin boswellia is often, so the combination of those will definitely work. Yeah, definitely Lymphodrop.
Okay, great. Now we have another question about what your recommendations on periodontal infections would be, and if this is part of the lymphatic constitution?
Not necessarily. We need the lymph to drain the infection, the lymph drop to drain the infection out of there, because this we can find in all the constitutions. It is often caused by specific bacteria, and we can use also the fungal remedies for that. I often use the Pleopef for that. It's very successful. And, of course, we miss some of our other Sandem ones that would really work for that. But, yeah, the fungal remedies are extremely successful. I don't know, Heather, if you have any other suggestions for that.
Pleopef, I know from the general category, Pleopef using the suppositories orally, cut into small pieces and packed in the affected area before bed is the kind of specific remedy, and then acid-base balance and acid alkalizing is another part of it, and that is part of biological medicine. However, periodontal disease, I also know from biological medicine and also from Dr. Klinghardt and biological dentistry that it's not kind of just so straightforward. There's often other things that are involved, and a lot of that has to do with excess toxicity in the body, including mercury, non-compatible dental materials in the mouth, or too many different types of dental materials that are in the mouth. And then root canals can be part of that as well, and the microbiome in the mouth potentially, being out of balance, and maybe a bigger reflection of the microbiome and the terrain of the body being out of balance. So with periodontal disease, it's not just about using Pleopef suppositories, but it's about doing quite a bit of deeper, more terrain work and matrix milieu and detox and homotoxicology and all of those types of things, so that you can really get to the root of why the mouth and the teeth are all being affected the way that they are. But the short answer is you can get some definite benefit by using the Pleopef suppositories orally.
Yeah, and don't forget the probiotics too.
Yes, exactly. And we can't also forget about Streptococcus mutans, which is the #1 offender in the mouth as far as bacteria go, and that species can cause a lot of issues in the mouth for sure. Okay, well, with that said, with all of that said, once again, thank you everyone for joining us tonight on the Constitutional Medicine Part 2 with the focus on the lymphatic constitution. And Henrietta, I want to also say a great thank you for sharing your wisdom and your knowledge and your clinical tips and your clinical pearls. And then in addition to all of that, because you have that expertise in constitutional medicine, being able to share all of that about the lymphatic constitution can really help, I'm sure, all of us with our patients and in our practices. So not only was tonight in the lymphatic constitution webinar a really great learning spot, but I look forward to the next one on the hematogenic, did I get that right? I think so. Hematogenic constitution and the liver and digestion and circulation, and really diving into that aspect. And so it will just add one more really amazing layer of knowledge to apply in practice. So thank you so much, everybody, and thank you so much, Henrietta.
It's my absolute pleasure.
Until next time, have a wonderful evening, and we'll talk soon. Take care, everybody.